folks hear me? Yeah? Okay. So welcome, everybody. Thank you so much for coming today to this panel on teen mental health. We're very excited to be here. We're all from the Department of Psychiatry here at Stanford in different roles and different expertise. I'll be moderating the panel today and introducing our three panelists to start. Adolescence has been recognized for generations as a particularly vulnerable period of life. And I think we're all in our community particularly aware of how vulnerable it is, given the recent suicides and the overall concern for our young folks today. So we're really happy everybody could be here. I'm going to start by introducing the panelists. Here to my left is Dr. Moira Kessler, and she's a psychiatrist in our department who does school-based mental health consultations and helps schools also with suicide prevention programs. Next to her is Dr. Helen Wilson. She's a clinical child psychologist in our department, and her area of expertise is risk-taking in adolescence. And then finally, Dr. Ryan Matlow, who is also a clinical child psychologist involved in early life stress and pediatric anxiety, our program here at Stanford, and he's an expert in mindful-based stress reduction and also the impact of early childhood trauma. So why don't we go ahead and open it up to the panel. Let's begin with Dr. Wilson. Can you tell us a little bit about normal adolescent development, and then in particular, why adolescents are so vulnerable to risk-taking and what kinds of risks, and how we who are parents or teachers can talk to adolescents about risk-taking behavior?
So who here is a parent of a teenager? Most of you. Is anyone a parent of a younger child? And I see maybe a couple teens out there as well. So adolescents are my favorite group of people to work with, and I find adolescence a really fascinating time of development. So some really important things are happening during the teenage years. In terms of brain development, it's one of the most critical points of development. So different pathways and connections are getting established that largely determine how an individual turns out later in life. Adolescents, of course, are establishing independence and autonomy from parents. So it's really important for kids to be able to make choices and have a part in making decisions over their lives, and even sometimes to make mistakes and be able to learn from those mistakes. However, as we know, adolescents also need a lot of guidance and support from their parents because they're not always good at making decisions yet, and I'll talk a little bit about why that is. Other things that are happening in adolescence, so adolescents are establishing identity, they're exploring different roles, trying to figure out who they are and who they want to be. Adolescents are exploring different values and oftentimes exploring things that may be different from their families and what their families believe. And because of this, adolescence can also be a time that's really stressful and really hard. So I actually oftentimes see parents on their own come to me because of the stress of raising a teenager. And one reason that adolescence is stressful is because teens take risks. So I know these are the things that keep you awake at night as a parent of a teenager. So about 75% of high school students will try alcohol before the end of high school. 50% have used illegal drugs. 50% have smoked cigarettes. 50% of high school students are sexually active. The highest rates of crimes in the United States are committed by 17 and 18-year-old adolescents. So it's no surprise if your teen has tried one or more of these things before the end of high school. Now, that's not to say these are things that we should ignore. Of course we want to pay attention. Of course we want to talk about it. Of course we want to give some guidance and direction so that teens can make healthy choices. But if we approach it from this framework, knowing that, these are things that are a part of a typical adolescence to some extent or another. Now, where we want to be concerned is when these kinds of behaviors become a regular, repetitive, chronic pattern and when they start to interfere with other aspects of life. So, a teen who's tried alcohol or maybe drinks alcohol occasionally with their friends in social settings, that's within the normal realm of adolescence. However, if your teen is drinking or smoking by themselves before school, if it's starting to get in the way of school, if their grades are suffering, if it's getting in the way of spending time with family or friends, that's a big concern. That's something to really make a big deal out of and pay attention to. And with these other things, again, it's about paying attention, but knowing that this is a part of being a teenager and perhaps not catastrophizing. It doesn't mean that your teen is a deviant or there's something wrong with them if maybe they've tried one or more of these things. But of course, there are things that can get them into trouble. So let's talk a little bit about why teens take risks. Well, first of all, they're a part of those normal developmental tasks that I just mentioned. So taking risks is about exploring different roles. It's about being independent from parents and families and trying out things that maybe your parents don't want you to do. It's about developing autonomy. It's about spending time with friends and exploring peer groups and peer relationships, which is, of course, another important part of adolescence. So something I didn't mention is the development of intimacy and dating and romantic relationships. And some of these things happen in the context of those kinds of relationships. And what's happening in teen brains is also really important here. So deep down in the middle of our brains is a part of the brain called the limbic system, or the amygdala is also involved. And these parts of the brain relate to the processing of emotions and responding to emotions. And in teens, this emotional part of the brain is on overdrive. It's really active, it is really sensitive, and that's why teens oftentimes are very emotional. Teens can be moody, they often make decisions based on emotions. That's why they can be impulsive, that's why they can take risks. And at the same time, the part of the brain that's in the very front, the prefrontal cortex, is not quite yet doing its job. So the prefrontal cortex is developing during adolescence and actually continues developing until the early to mid-20s. So you've got a really active emotional part of the brain and the rational, thinking, decision-making part of the brain isn't quite up to speed yet. So that's why kids sometimes do really weird things and also do risky things. So I want to go to the example of sexual behavior. So sex is a topic that can be really scary for parents and really awkward and uncomfortable for parents and teens to talk about together. And this is an area that I spend a lot of my time, both in my research and in working with parents and teens in clinic. So as you see here, by the end of adolescence, about 7 in 10 kids are sexually active. And that doesn't mean that they're just going off to college and having sex. So about 60 to 65% of high school students say that they've had sex. So trying to prevent teens from becoming sexually active altogether may be a losing battle in many or most cases. However, at age 14, so 8th, 9th graders, the beginning of high school, only about 1 in 10 kids is sexually active. So early in adolescence, it's not really a typical normative kind of behavior or activity. So what we want to do is to help kids delay sexual activity, to delay sexual experience into later adolescence. We also want to help them to make safe and healthy choices when they do become sexually active. So what I mean by that is having sex with one partner and being protected. So it turns out that the United States has, compared to other westernized, developed countries, has the worst rates of teen pregnancies and childbirths, the worst rates of teen abortions, and the worst rates of sexually transmitted infections in teens. Now, why is that? Well, it turns out it's not that American teens are more likely to be having sex or having sex more often, but teens in other places, European teens, for example, are much more likely to use double protection when they do have sex. And what I mean by double protection is to be using an oral contraceptive, so the pill or the monthly shot, something like that, and then also using condoms every single time they have sex. So these are some of the kinds of things that we want to be able to help kids with when they decide to become sexually active. We want to help them to be choosy and picky about who they have sex with and when they make that decision, and we want to help them to be safe. So how do we talk about this topic? Again, this is the kind of thing that most parents and teens do not look forward to. And so I've actually, I think at the end and on our website, I've provided some resources that may be helpful. So there are a couple websites. There's a young women's health site and a young men's health site. And these are resources on all kinds of health-related topics. So it includes nutrition, emotional well-being, all kinds of topics, including sex and reproduction. So it can be a way, so looking at some of these kinds of resources together could be a way to work in the talk about sex as well. Also, the Planned Parenthood website has some nice pages on tips for tools and tools for parents. And in the parent section, it provides some nice tips on how to talk to your teens about sex. And what we know is that this doesn't have to be, it doesn't have to be a big talk. Like, you don't have to sit down for the big talk. But that it's often more effective if it's something that you can kind of naturally work into conversation. And then it can just be a normal kind of topic that comes up, even starting earlier in life, even starting before adolescence, for talking about things like childbirth and reproduction just to be a normal topic. And you can capitalize on learning moments, perhaps in a TV show or a movie. Maybe your neighbor's pregnant, maybe a classmate's having a new sibling, and to be able to open up a conversation about those kinds of things. It also turns out that it's not about how often you have these conversations. It's not even about exactly what you say or what topics you cover, but the most helpful, most effective kinds of communications about sex and these other risk behaviors I've mentioned as well are conversations that are open and receptive. So being able to listen to your teen, to listen to their perspective, even if you don't agree with what their views are, but to be able to listen and respond in a supportive and respectful way, and to be able to hear their questions, to find out, what do they already know? What questions do they have for you? And if you don't know the answer to those questions, you can use some of the web resources we've provided or help them talk to their doctor or the school nurse or someone who might be able to help answer those questions. And in the context of those conversations too, again, kids also need our guidance. They also need direction from parents, so they may think that they know everything, but we know they really don't. We know that even though we hear a lot about peer influence and how much peer influence matters for teens, and yes, that's certainly true, but particularly around things like sexuality, kids really value input from their parents. They realize that their friends don't know everything and that you have certain experience and knowledge that can be really helpful. So share your values. Share what you know about what it takes to have a safe, healthy relationship. And if you have certain values from your culture and religion, share those with your kids and explain why, but in a way that is also respectful and understanding if maybe they have different ideas about things or maybe end up making a decision that's not exactly what you would want. So I'll stop there.
Thank you, Dr. Wilson. Her listening to your adolescent's questions reminds me that I forgot to say that we have cards for you all to write down your questions, and that moderators will bring those cards to you. And at the end, we'll go ahead and take those cards, and our panel will answer the questions that you have. So please feel free to raise your hand, and someone will bring you a card. Also, at the end of today's presentation, we will have both handouts for resources for teen mental health in the community, as well as a slide that we'll show at the end with resources for teen mental health. Okay, so let's go on to Dr. Matlow, who's going to talk to us about stress and stress reduction in teens.
Exactly. So, I'm going to talk a little bit about how stress impacts teens and what we can do about it as a family and as families and as communities. And so this is an important issue because we know that there's lots of reasons for kids to be stressed these days. Different things are going to be stressful for different kids. For some, it's dealing with academic pressures. Others have financial or economic stresses in their families. Other kids are dealing with loss or trauma or grief or perhaps violence in their community, right? So there's lots of different things that can be stressful. And these stresses make the kind of normal developmental challenges and processes that Dr. Wilson was talking about even more challenging and kind of exacerbate some of those challenges and difficulties. But that's not to say that all stress is bad. A certain level of stress is good for us, right? when we have a stressor or a challenge, it gets our bodies activated, right? There's a stress response that kicks in where, it activates hormones, cortisol and adrenaline that kind of get us activated to kind of meet that challenge, right? And so when we meet the challenge of a certain stressor that is presented in our lives, it helps us grow, and it helps us kind of expand our coping skills, right? So stress is part of the normal developmental growth and processes that all kids are going through, right? But there's a certain level at which stress can be harmful, or it can become toxic to kids, or to anybody, really. Basically, when a stressor is chronic or constant, when there's no reprieve from that stress, and difficulties that it's causing, or sometimes in cases of extreme stress, in cases of trauma where someone's safety or well-being is threatened, that can be overwhelming. Basically what happens is at that point stress starts to overwhelm our systems, right? It overwhelms our resources and our capacity to cope with what's going on, and it can cause our systems to kind of go offline. In particular, for teenagers, Dr. Wilson spoke about the prefrontal cortex that's developing, and some of these parts of the brain that help us kind of manage our system and help us grow can kind of become less functional under stress and can kind of go offline. And those same processes that cortisol, that adrenaline release that helps us meet the challenges that come with stressors can become dysregulated. It can become toxic and harmful to our system in the long run. So yeah, these stressors again can start to overwhelm our resources and our capacity to cope. And so this is probably intuitive for a lot of folks out there. But there's a wealth of research and work that's showing us that's showing direct links between toxic stress, extreme stress, and difficulties with learning, for example, or memory. With memory, our ability to focus, our attention, right? That again affects our learning. It also, these stressors impact our ability to kind of regulate and manage our emotions, which is difficult enough for a teenager or a kid who's still kind of, their brain is still developing, and these processes are developing. The added stressor in our lives makes it even more difficult to kind of to manage these sometimes challenging or overwhelming emotions. Chronic stress, toxic stress can impact our immune system functioning, so our body's ability to fight off illness or infectious agents that are out there, right? It impacts sleep, right? So we know that there's a connection between toxic stress or extreme stress and sleep quality. So having experiences of toxic stress or trauma is associated with less time spent in deep sleep or REM sleep, which we know is important for memory consolidation, for helping our brains kind of regain the kind of chemical balance, right? So it can have kind of this negative effect. That it can kind of be interactive and can kind of be a downward spiral sometimes because the stressor is kind of throwing off these systems that help us regulate, and it interacts in this way. And ultimately, this leads to some of the impulsive or risky behaviors, sometimes called negative coping strategies, that Dr. Wilson alluded to and that Dr. Kessler is going to speak about in just a moment. Just to say briefly, these strategies, these kind of impulsive or risky behaviors are attempts to cope with the stressor, right? It's trying to manage the stress that's been presented in the best way possible. But with all these other systems that are somewhat offline, it leads to these attempts to cope turn out to be risky or harmful potentially in the long run, right? So all this to say that stress is okay, and it's part of our growth. It's okay if it's temporary or manageable, when the stressor can pass or when we're able to meet the challenge of the stressor. But when it becomes chronic or extreme, it starts to eat up kind of our resources, our body's resources. So, when I say resources, I mean our biological resources, our psychological, mental resources, and our physiological resources, like the systems in our body that help us maintain a balance in our lives, right? So with these extra stressors, toxic stress or trauma or whatever it might be, our resources are devoted to dealing with that stressor, to dealing with that challenge, right? And so what that does is it derails the normal developmental processes and developmental growth that is happening during adolescence, right? So given this climate, given what we know about the impact of stress, one thing that's really important for folks to be thinking about is building structures and routines where kids have some relief from these stressors, finding a balance, knowing that some stress is good and that kids and teens are working really hard in a lot of ways. We want to find a balance, and we want to help kids develop the the routines and habits that give some relief and reprieve from the stressors that are out in the world these days. Oh, excuse me. And this is where kids and teenagers can really use the support of adults and parents and caregivers. Kids are still learning how to kind of navigate this world, so we can, as adults and as a community, we can really help kids by helping them establish the structures and routines that are going to help them take care of themselves and establish that balance, right? So one way this is happening right now, there's a lot of exciting growth and momentum around practices such as mindfulness, yoga, and meditation practices. That these are some ways to build in this type of structure and this type of balance into kids and teenagers' lives. I'm not talking about religious practices per se, but just kind of the physical and mental exercises that provide space to be free from the stresses in our lives, to be free from the worries that are affecting us, right? And to build some skills for coping with stress. So just to kind of explain real quickly what mindfulness is, it's described as a state of awareness where you're focused on the present moment, on current mental state, physical state, or emotional state, right? Just being in the here and now. And this makes sense in a lot of ways because a lot of our stress lives either in the past or in the future, right? Either thinking about or ruminating about something that happened in the past or worried about something that might happen in the future, right? And so one of the principles of mindfulness is that if we can focus on our current, present physical state, we can relieve ourselves of some of that stress, right? Another component of mindfulness is compassionate acceptance of those kind of physical and mental states. So knowing that stress affects us, but instead of kind of fighting that stress or avoiding it, which can kind of be harmful in the long run sometimes, we want to accept that, I feel stressed out right now, but this is something that's going to pass, right? So it's kind of, part of what we can do with these exercises and practices is to shift people's attitudes and teenagers' attitudes and perspectives on stress so that they're more, so it doesn't have such a negative impact or consequence on their lives, right? And one exciting development that's happening right now, there's a lot of growth around in school-based programs to incorporate these skills and practices into kids' daily routine, right? We know that school is a source of stress for many kids and teenagers, right? So if we can incorporate these rituals and routines involving mindfulness or meditation or yoga, we can build this in. This is one way of building this into kids' everyday lives, right? And so this looks differently in different places. In some places, there are programs which, on the website, there's some resources of specific organizations and programs that are doing this work, so that there's some resources for folks to look further into. But in some cases, folks are incorporating yoga into physical education programming, so incorporating yoga exercises into PE curriculums, right? And in that way, giving kids the opportunity to learn these skills. In other schools, they're structuring the school day so that there's 10 or 15 minutes of just quiet time, right? Which can be used for meditation, but really the idea is just to have some free space to help kids clear their heads a little bit and to have a break, to have a reprieve from the stress, from the go that's part of, being successful in academics in school these days. And then there's other curricula that are out there that are just focused on integrating mindfulness skills into the classroom so that kids are learning this and practicing this on a day-to-day basis. So these programs are really exciting. There's a lot of growth and momentum out there right now in developing these types of curriculum, these types of programs at schools. And kids are speaking to the impact that this is having on them. So kids really speak, kids that I've worked with and kids that I've seen, they talk about having this time, having this space at school in class really helps them to calm down, right? It's a place that kind of takes away their troubles, right? When you have this kind of downtime, this quiet time, it takes away the other troubles and stressors in their life. So there's some kind of kid testimony to all this, right? Other kids say that it gives them something to do. If they're feeling anxious or overwhelmed or angry about something, that these practices and skills gives them a place to turn to. So it's like a tool in their toolkit for dealing with the stresses in their lives. And this is getting played out in research, right? So programs, folks that are evaluating these types of programs are seeing improvements in academic performance when these programs are being implemented. When kids have this quiet time or downtime, they're seeing increases in improvements in rates of attendance, improvements in behavior, so reduced behavior problems or discipline problems, improved emotional health, and connecting back, improvements in sleep quality and sleep function. So I'm talking about school programs, but there's lots of different ways that these exercises, these practices can be structured into kids' lives. And the most important thing, so they can happen at school, these practices can happen at school, they can happen at home, they can happen at work, they can happen in sports, right, in outside recreational activities. So kind of have to think creatively about where to incorporate this and what works best for each person. There's not one kind of cure-all that I can say everyone should do. Everyone kind of has to figure out what works for them. Every kid, every family has to figure out the structure and the habits and routines that's going to work for them to have this reprieve, this kind of release from the stress. So I just encourage folks to kind of to have this conversation, learn a little bit about the programs and options that are out there, to talk to your kids about what's stressful for them and when they're having a relief from stress, with the goal of striking that balance, right? There's so much stress out there. Kids are working so hard in so many ways. We just want to make sure that they have the time and space to have some reprieve, some release from that stress, and that they're developing the skills that not only help them manage the current stress in their lives, but it also can be protective moving forward. When kids are practicing these skills and strategies, we know that they're more resilient in the future, that when stress comes up later in their lives, they're more equipped to kind of deal with those things in a way that promotes kind of normal, healthy development.
Great, thank you, Dr. Matlow.
Thank you.
Okay, Dr. Kessler, can you tell us about adolescent depression and also suicide?
Oh, thanks. So there are many reasons why it's important to hear about depression and to learn about the science of depression. First of all, depression is very common. In fact, 1 in 5 adolescents will experience depression before the age of 18. So if your teen hasn't experienced depression or isn't experiencing it, it's very likely that one of their friends is or has. Also, the good news is that depression is treatable, and the earlier we detect it, the easier it is to treat. So that's why it's very important to identify the signs of depression. And finally, the consequences of depression can be devastating, not only to the individual experiencing it, but also to their family, and then in addition to the community, just as our community has experienced tragedies this year. So I'm first going to talk about some of the causes of depression. And what's really important to know is that there's not one cause of depression. I've had many teens and families come into my office confused, not understanding, I do well in school, I have a great family, I have lots of friends, I don't know why I'm depressed. And it's because it's from many causes. There's many factors that interact with each other, and it's that interaction, the perfect storm, that often leads to depression. So as clinicians, we often talk about the biopsychosocial model of depression. So if you look at the biological end, depression tends to run in families. So oftentimes teens with depression have other family members that have experienced depression or other mood problems. Also, it's important to note that depression is like a medical illness. It's a brain disease, and we often see different levels of chemicals in the brain, specifically serotonin, in people that are depressed. The other factor we look at is the psychological aspect, and one way of looking at it are negative thought patterns in people that have depression. So a teen with depression might get a bad grade on an exam and think, I'm a bad person, I'm a failure, I'm never going to amount to anything. Whereas another teen might look at it and think, wow, that test was really hard, I didn't study hard enough, my teacher didn't teach me well enough. For those teens, they can solve the problem. There's an external factor that led to this problem. Whereas the other teens, they really see it within themselves, within others, and really see their future as hopeless. And as Dr. Matlow spoke about, many teens with depression either lack positive coping strategies to deal with stress or have negative coping strategies. And for those teens, the ones without coping strategies, the stress just can build up. So bad score on an exam, fight with their parent, break up, it just builds up and builds up and builds up, and stress can become distress and can contribute to depression. And other teens have strategies that might feel good in the moment. Either they can avoid the stress or numb themselves, but they lead to very negative consequences later on. So that might be, drinking or drugs or self-harm, such as cutting to deal with stress or depression in the moment, but really leading to negative effects in the end. And finally, we look at social factors. Those are the things that are a little bit easier to identify. That could be stress in school, a breakup, a divorce within the family, or violence in the neighborhood. So what should you look for in your teen? I'm pretty sure we all would imagine that our teen, if they're depressed, are going to look sad, and that's pretty easy to imagine. But in fact, many teens and children who are depressed actually are irritable. So that might be chronic crankiness, moodiness. being on a short fuse, arguing very often, snapping back at you. You also want to look for a decreased interest or pleasure in activities they normally enjoy. That might look like being chronically bored or dropping out of activities or really isolated from friends or family. I've had families come in and say, my kid is lazy. They used to go to all these activities and they used to study really hard and they don't want to do anything anymore. If your kid wasn't lazy before and is lazy now, it's probably not laziness. It's really good to keep depression in mind if something like that's happening. You might also see a change in appetite. So many teens with depression have decreased appetite. You might notice that you have to remind your child to eat meals. And also, if you think of getting stressed, for me, I definitely like to go to carbs. And some teens and adults with depression also find themselves craving carbs and really eating more than usual. You might see a change in sleep, either trouble falling asleep, not sleeping through the night, or you might see your teen sleeping all the time and complaining of never feeling rested. That can also be a sign. Another symptom is change in energy. So your teen might complain of just having no energy, almost feeling like they have the flu all the time when there isn't really a medical reason. Another symptom is feelings of guilt or worthlessness. That might be described as feeling like a burden on others. And that can really impact the ability for your teen to reach out to you for help. If they feel like they're not important and their suffering would just cause suffering to others, then it really makes it difficult for them to speak to others. And finally, another symptom can be thoughts of death. That might be fantasizing about what life would be like if they weren't alive. It might be thinking about just wanting to go to sleep and never wake up again. Or it might be thinking about doing something to end their life. One important note is that in different cultures, depression can look very differently, especially in cultures where it's discouraged to talk about feeling sad or talking about your problems or just not really having the language for that. In some cultures, depression might actually be described in physical symptoms, so having pain or numbness. And actually, in smaller children, we often see them having a lot of stomach aches and headaches when there isn't a medical cause for it. In other cultures, it might actually come out more as acting out behavior, so getting in trouble, stealing, lying, doing things you didn't normally do. It's really important to look for changes in your child's behavior. So if they were a really outgoing kid and all of a sudden they just keep to themselves, that can be a sign. If they really used to participate in a lot of activities and now they don't, they just like to sit in their bed and do nothing, that's another sign for it. So it's really important also to differentiate between stress and depression because they can look very similar, and just as Dr. Matlow talked about, we all experience stress, and an amount of it can be good, it can build resilience, but too much of it can impact you, lead to distress, and can contribute to depression. So one important difference between stress and depression is that there is an external reason for stress. So it might be finals or a deadline or getting a speeding ticket. And after that stress goes away, then you tend to bounce back, get back to your normal self. But in depression, you don't have that bouncing back. In depression, the symptoms are too frequent, they're too severe, and they last too long for you to manage on your own, and that's when you might need outside help. They also impact your functioning. So especially for kids, you might see them doing poorly in school, having difficulties with friendship and different difficulties with their families. And that's important to note. So what should you do if you're concerned about your teen? And a lot of this is very similar to what Dr. Wilson said. It's important to approach your teen in a gentle way, in an open way, a non-judgmental way that really makes them see that you want to hear what they have to say and you're not going to judge them. It's important to find a good time to talk with them. If you're concerned about them, approach them as soon as possible, but just ask them, can we talk right now? And if this isn't a good time, then schedule a time for them. You don't want to talk with them when they're in the middle of studying, when you have a deadline, when you both don't have really a very long period of time to talk. Find a private place. Make sure you don't have only 20 minutes and you have to run. You should put away your phone. Your kids should put away their phone. You don't want any distractions. Make sure to make good eye contact with them. Watch the tone of your voice. You want to speak with them gently and really let them know that you're concerned and serious. Make sure to listen. I want you all to practice over the weekend in a conversation, just sitting and not talking for 30 seconds when the other person's talking. You'll notice that you hear a lot more than you normally really do and the person really feels listened to. You know, we live in Silicon Valley. We have a lot of smart problem solvers here. But it's very important to know that your kids don't necessarily want their problem solved right now. You might not know what they need in the moment, and the only way to know is just to ask them. So, you know, they might just want you to listen. They might just want a hug. They might want you to drive them to Phil's and get them some coffee. But you won't know unless you ask. Another important point is to validate your child's emotions. Validating means that you're showing them that you understand why they feel the way that they feel. It does not necessarily mean that you agree with them. So a way to validate your kid might be if they talk about, oh, I'm so upset, I'm getting B's in my classes, and I'm just so stressed. If you say, I'm so sorry you're feeling this way, what can I do for you? A way to invalidate your kid would say, oh, that's not that bad. I got B's in school all the time. It's not the end of the world. That's really telling them that their emotions don't matter, and it makes them feel like there's something, you know, there's something wrong with them that they can't deal with it. Another important point is to avoid the word but. So if you say, I'm so sorry you're feeling stressed, but it's not a big deal. It's as if you didn't validate them in the first place. Remind them that you love them, you're there for them, and you're going to get through this together. A lot of teens feel isolated, and they feel like their future is hopeless. So by using we are going to get through this together, it makes them feel that you're in it as a team and that there's hope. Also, it's important to share your observations with them. You know, I've noticed that you're not eating dinner with us anymore, and you're sitting in your room for much of the night. Just stick to the facts. Let them know that you notice things, that you're paying attention to them. Finally, it's very important to ask about suicide. And there's been a lot of research that shows that asking about suicide does not increase the chance that your child will act on suicidal thoughts or attempt suicide. But if you don't ask, you don't know. That's another homework assignment I'll give you all. It's to ask somebody. It doesn't have to be your teen. Ask somebody if they've ever considered suicide, if they've ever thought about death. And you'll be surprised. Many people have thought about it that you never would have thought of. The question, it's very uncomfortable, very awkward the first time. But for me, I ask every single patient I see every single time, and it can become much more comfortable in that way. If you don't know what to do, we actually are going to provide you a resource if you'd like it. There's a suicide prevention training called QPR that actually faculty, staff, and students in our district have done. And at the end of the session, we'll have the opportunity for the first 100 people, I don't know how people are here, that would like to get trained. If you just go to the back of the room, we can give you the link to the source, and it's very helpful.
Great, thank you so much. I'm going to go ahead and start with the questions from the audience. This first one, Dr. Kessler, I'll direct to you, and it's a very straightforward question. What is the most effective deterrent to suicide? So how do we help people who are thinking about ending their lives? How do we prevent suicide from happening? What are some of the, especially among adolescents, you might talk a little bit about the contagion factors and some of the, how the media can help us prevent the contagion factors, and also on an interpersonal level, what we can do with somebody who's endorsing suicidality.
Yeah, so it's a very complicated question, and there's not one way that we can prevent it the most, but there's many ways. So first of all, it's important for kids to have a trusted adult, to have somebody that they feel comfortable talking to. So it's making sure, if it's not you, it can be someone in the community, it can be a teacher. If you're worried about your child's safety in this moment, the way to prevent it in that moment is making sure they're somewhere safe. So actually the slide that's up right now shows what to do in a crisis. If you've asked your child about suicide and they're considering it and they don't feel like they can keep themselves safe, you can call 911 and ask for a CIT officer. They can come and evaluate them in the home. You can take them to the emergency room. Stanford has a child psychiatrist on call 24/7. If you're a Santa Clara County resident, there's the EMQ Mobile Crisis Unit. They're able to come and evaluate your child in the home at times. If not, they can help direct you to the care you need. And then there's other numbers to call. There's the Stanford child psychiatrist on call that is available after hours and on the weekends, and they can help guide you if you need to take your child in at the moment. And there's many other aspects to trying to prevent suicide. education is important, so being here is extremely important. There's been policies passed statewide that all teachers need to have mental health education, so they need to be trained in identifying depression and other forms of mental health disorders. We're teaching our students as well. I know in the living skills class, we actually bring in a lot of suicide prevention courses that I've helped teach some of them to the students.
Yeah, I would just add to that because we have a lot of questions
Yeah.
to go through. So, yeah, in particular with adolescence, there's this contagion phenomenon, sort of like a flock of birds. As soon as one takes flight, the rest follows, and that's much more true among teens who are suicidal than other demographics, which is why it's so important to minimize the contagion phenomenon. And one of the things that the data show is that the media can help by not being too explicitly detailed about the circumstances surrounding a teen suicide, because that then propagates through the media and through the internet and then actually increases the odds of other teens modeling that behavior. The other thing we know about suicide is that actual physical deterrents, like a net under a high bridge, or potentially for our community, video cameras along the train line are indeed, and higher fences along the train line. Many people poo-poo that because it sounds like, well, what is that possibly going to do for a suicidal kid? It turns out suicidal teens act a lot on impulse, and it's an in-the-moment kind of a thing, not necessarily long premeditated. So if it is physically more difficult for them to act on their impulsive thoughts, it decreases the risk of suicide. Okay, let's go on to another question. Let me direct this to Dr. Matlow. The question here is about zero periods. And as you know, at Gunn High School, they've now eliminated unilaterally zero period, so that with the idea that part of the risk of suicidality and stress is that kids are not getting enough sleep. They're not getting enough sleep because they start school too early. This is the thinking here. This is not my thinking. And that if we eliminate zero period like they've done at Gunn, we'll decrease the chances of them being sleep deprived because we're starting school at a later time. How can you educate us about your thoughts about that vis-a-vis your understanding of the role of stress in adolescence?
Thoughts about zero period specifically?
That was the question.
Okay.
That was the question, yeah.
Yeah, I mean, so it is important when I talk about having healthy routines and healthy structure in teens' lives. Part of that does have to do with sleep hygiene, right? So we know that an adolescent should on average, get about 9 hours of sleep every night. So whether that means, and that's, people shake their heads at that, right? Because there's so many things the kids are having to work on, that they're working towards, that it's hard to kind of guard that time, right? But part of having that as I spoke to, sleep is an important part of maintaining a healthy balance and increasing capacity to deal with stress, right? So it's important that kids have the routine and sleep hygiene that helps them get the sufficient amount of time to sleep, because sleep does serve that important function of kind of re-regulating and rebalancing our systems. Whether that means kids should sleep later, I'm not sure. It's you may have to maybe establish a routine where kids are settling in earlier in the night, right? If they're going to be getting up earlier, you want to anticipate that and have the routine and habit so that you are maximizing the amount of sleep time that kids get, right? The other thing I would kind of think about is as we add in extra class time, extra school time, whether it's zero period or whatever it might be, we kind of think about the purpose or intention of that time, right? Is this extra work time where kids are going to, that may be kind of stressful in that way because, here's some extra time where I have to work on this project? Or is this a time where kids where it's a chance to kind of to regulate, to relax, to be free of the stress and the go of the academic pressures, right? So part of my response has to do with what that time is dedicated for, right? And whether it's something that's increasing kids' perceptions of stress, or whether it's an opportunity to kind of to calm down, relax, to focus on the here and now, and have a bit of a reprieve or release from stress.
Great, thank you. And I think, the whole zero period issue really raises the question for all of us, whether we're parents or mental health care providers. Is depression, is suicidality, is teen mental illness something that originates inside that individual, either due to early childhood trauma, biological predisposition, or is it something contextual in the environment? Do we need to change the school structure? Do we need to change something in our family? And these are really important questions that are complex, that we don't have the answer to, but clearly as a community and as healthcare providers, we continue to try to delve into those questions and figure out what to do. Here's a question from an audience member that I think also speaks to this issue of how much do I decide for my child, or how much should we as a community change context, and how much is this something that should come from within my child? The question is, and this is for, I'm going to direct this to you, Dr. Wilson. My daughter was admitted to a few colleges. We have very different opinions as to which college she should go to. Should we let her decide, or should we insist the college that we believe is right for her? What are your thoughts about that?
That's a really good question. And again, there's not one right or wrong answer. I would certainly encourage you to have an open dialogue and really try to understand the perspective of where your daughter's coming from. There certainly may be things that about the colleges that she's choosing between. I mean, I don't know what the choices are, but I know, a lot of parents, my daughter got into Princeton, but she doesn't want to go. She wants to go to this, small liberal arts college in Colorado. And maybe that small liberal arts college is actually a better fit for her. So I have actually a teen who went off to college last year, came to see me yesterday, and she's going to this smaller college, and some people were kind of surprised about why she chose this particular college, but it's ended up being a great experience for her, and her reasons for wanting to go there had to do with the particular, they had a particular kind of focused class structure, and it was a smaller school, and she had some really good reasons for making that choice, even if everyone else didn't understand why. And there are lots of great schools out there. Stanford, Princeton, those are not the only places where you can get a good education. And for some kids are too stressful or too big, or they don't offer something that your teen is really looking for. So I would say make it a conversation, try to understand their perspective, and certainly, like I said about these kind of risky behaviors, share your views, share your opinions, let them know, what you think, but I guess I would encourage you to steer away from insisting or pushing them to make a decision that doesn't feel right for them.
Yeah, I think that question really raises one of the real issues in our community here. One of our great strengths is the diversity of the different cultures that we have here. But then how do we merge those cultures, especially for our young people who are living in two worlds, going to school in one culture, coming home to another? When I hear Dr. Wilson's statistics about the number of Americans who have sex at an early age and get pregnant, I'm thinking, I don't want my kid to have that culture. I'd rather preserve some other culture and some other values for my kid. But then how do we kind of integrate the two of them? It's extremely challenging. In some ways, maybe our kids will be better off if we preserve our family culture and values and don't go we swim upstream in terms of what they're learning to do at school. And in other ways, maybe we're pushing too hard. So these are again, very difficult, challenging times and challenging questions. This is a question that came up in a number of different ways, and I'm going to direct this to you, Dr. Kessler. The question is generally, my friend who has depression is often upset because she feels her parents are treating her like someone who's very sick. What would you say to her, and how would you approach the situation so that she wouldn't feel so uncomfortable? And this question, I got a couple of these, and by the way, all the questions are excellent. I wish we had time to address all of them. But this question of, in what way is labeling someone with depression therapeutic for them? In what way is it actually stigmatizing them? And especially for a teen, making them feel even worse?
Yeah, that's a really good question. And so to some extent, it is really important and good to equate depression to something like pneumonia or to having another medical illness, because that does help destigmatize it. And you want, if your child is avoiding or ignoring or trying to distract themselves from having depression, then they can't really treat it. They can't really figure out why are they depressed and help themselves get better. So I actually encourage parents to think of it, that your child, think of it like they have pneumonia right now. It's going to be harder for them to go to school. It's going to be harder for them to concentrate. They're going to have some trouble with sleep. So we need to nurture them in the moment, but also talked about with stress, it's good for them to have a little bit of stress. So I think it's important to have an open conversation with your child. But what am I doing that's making you uncomfortable? Because, treating them, spending some more time with them or asking how they're doing more often, that's all very important. That's going to make sure they're talking with you. But not letting them, go do an activity with a friend because you're always worried what is going on when you're not with them, or not letting them make decisions on their own because you think that they're too sick to make a decision. That's taking it too far. So I think it's really getting specifics from your child about what am I doing that makes you feel uncomfortable, talking about it with them and figuring out what your comfort level is and what their comfort level is. But you just want to make sure that your kid is not in denial that they're sick right now. They need some help, because a lot of teens I've worked with here are so independent and so strong and hardworking that they just want to forget about the depression. So we don't want them to forget about it. We want them to deal with it and get through it.
Okay. Last question, unfortunately. So this is for you, Dr. Matlow. You mentioned downtime. How does video games fall into that in terms of downtime, and how much is too much?
Right. I knew that was coming. Yeah, no, it's a great question. So I'm glad someone brought it up. And so I think, I'll speak broadly about electronics, and not just video games, but electronics and social media. I think we can think of video games. A lot of kids talk about video games and electronics as being helpful because it kind of distracts them from the stresses of their daily life, right? And there's truth to that. And sometimes it's good to have a distraction, right? To be able to focus on something other than what's stressing us out, right? So there's a certain extent to which video games and electronics are helpful in the moment, right? What we have to be wary about is if this is avoidance, right? If this is a way of avoiding a stressor. I think we know anything that's stressing us out or that we're fearful of, right? If we just avoid that thing and pretend like it's not there, it's just going to kind of get worse, right? That thing gets bigger. That stress or that fear gets bigger, right? So if we're using electronics to avoid our stressor and pretend like it's not there, then that can sometimes be problematic. So there's a bit of a balance. There's an extent to which video games and electronics can be an all right distraction, but we have to make sure that it's not feeding into kind of the size or the quantity of the stressor. And the other thing I would say just real quickly is if we're thinking about like the concepts of yoga and mindfulness and meditation, is one of the central components of these practices and these philosophies is that you reach a state of calm and relaxation by connecting with your current state, as I mentioned, your current physical state, emotional state, mental state, right? Electronics, video games don't necessarily allow us to do that, right? We're focused on something else. It's a distraction, right? So in some ways, a lot of the video games and things like that don't necessarily allow us to reach kind of that calm state that we're really focused on what we're currently experiencing in the here and now. Again, it's a distraction that can help us get by in the moment, but doesn't necessarily provide that relaxation or that kind of restful recuperation that everyone needs to kind of get back on the kind of developmental track and to continue to learn and grow. So yeah.
Thank you. I just wanted to have one last question, because this was a topic that we didn't otherwise cover, and I think it's important that we just address it very briefly. And I'm going to direct this to you, Dr. Wilson. This writer says, when I noticed my 14-year-old girl has cutting marks on her wrist, what should I do? When I asked her, she said it was nothing. Please advise.
Yeah. And I might ask Dr. Kessler to help with this too, because I know you work with a lot of girls with these behaviors as well. So first of all, there are, and this also relates to some of what Dr. Matlow talked about, so people sometimes do self-harming things like cutting to cope with stress or feeling overwhelmed emotionally. And actually there are, and I know this sounds really weird, but there's some good neurological reasons that it works. So when you do something that hurts, like cutting, it actually releases endorphins in your brain that can have a calming, relaxing effect in that moment. And of course, similar to what Dr. Matlow said about video games, it doesn't end up solving the problem in the long run or really dealing with the stress. And also, so most of the time when kids are cutting, they're not actually trying to kill themselves, so it's different than a suicidal attempt or gesture. So it could be a way of coping with stress. It could be a way of trying to get attention from adults, trying to let you know that they're in pain or struggling in some way. But the problem is, of course, that you can make a mistake and end up doing something to really hurt yourself. So, I mean, I would say that that's a time when you do want to seek help from a professional, because we have treatment. So Dr. Kessler is an expert, or one of our developing experts, in a treatment called DBT that's developed for helping kids with self-harming behaviors and intense emotions, and who have difficulty finding good ways to cope with those emotions. So we want to help kids find other ways with dealing with those things. We also want to make sure we're paying attention to what's going on with your teen, so noticing if they're distressed or stressed or feeling depressed, rather than paying attention to something that's a dramatic kind of gesture or crisis type gesture. Anything you want to add to that?
I was just going to add, because I think everything you said was great, was, it's a sign that there's some stress that's too difficult for your child to cope with at the moment, and that they lack really positive coping strategies to get them through it. So a good first step, if I talked about what to do in a crisis, but if you're concerned about your child and really you don't know what to do, a good first step is to call your pediatrician and make an appointment, because they actually know how to assess for depression. They can help make referrals, or to go to your child's school and speak with the school psychologist, the counselor, their case manager, because again, they can help figure out what your child might need. And we actually have a partnership between Stanford Child Psychiatry and the school district, and at times we can actually assess children at the school and help make recommendations. But they're at some sign that they need some help, and there's various ways they can get it, because I know that it can be very difficult to find a mental health provider, and it can take a very long time. So these are some good steps that can really help you and your child very quickly.
Okay, thank you all for coming today, and thank you for our panelists. And the panelists will be up here for another 15 to 20 minutes or so if folks want to approach with other questions. Thank you.
The preceding program is copyrighted by the Board of Trustees of the Leland Stanford Junior University. Please visit us at med.stanford.edu.